This is Dr. Sushma, Pediatric Ophthalmologist, Rainbow Banjara Hills. Today I'm going to speak regarding vision impairment. So, what is this vision impairment? This is something where a person has loss of partial or complete ability to see things. That means complete or partial blindness. This is called as labeled as vision impairment. So generally we measure vision in terms of two factors. One is visual acuity and other is visual fields. What is meant by visual acuity? Visual acuity is nothing but the clarity of an image which we measure with the help of a Snellen's chart in our OPD. And the visual field, it is something which is related to area from which a person can perceive a vision when looking at straight without moving the eyes or head. So when the person is looking straight, and the ability to perceive image within an area is called visual field. So these are the two factors which we measure in a OPD to diagnose as visual impairment. One is visual acuity and visual fields. If this visual acuity and visual fields are less than the standard, then we label as visual impairment even after treatment with glasses or contact lens or surgery, medicine. Even after treating any eye condition, if the vision doesn't improve, then we label it as vision impairment. So what causes this vision impairment? In childhood or in the newborns or in the early childhood, there are some reasons why they end up having visual impairment, like any inherited, that means any genetic issues like retinal dystrophies or degenerations or corneal infections, corneal dystrophies or corneal degenerations, which are inherited from parents with the help of genetic issues. And second thing is any infections which are carried from mother to fetus during delivery. Those also can lead to vision impairment. And third thing is any kind of eye or vision problem which is not identified and treated on time can lead to this vision impairment, or called as amblyopia, which is also a form of visual impairment. So these are the reasons for early childhood vision impairment. And there are some causes which can cause vision impairment in the adulthood or in the old age, like diabetic retinopathy, age related macular degeneration, or any kind of eye injuries. Can also, any accidents causing eye injury can also lead to vision impairment. So any eye condition which is not treated and on time can lead to vision impairment. So early identification and diagnosis and treatment of any eye condition is very important to not getting into turn into a visual impairment. And what is the treatment for this visual impairment? So visual impairment, as I said, even after every kind of eye treatment, the vision doesn't improve, we call it as vision impairment. So what do we do for these kind of kids who have vision impairment? We generally have many kind of low vision aids. So these vision aids will help the kids to perform their day-to-day activities, or some kind of magnifiers or some kind of telescopes. These are called as low vision aids, which will help the kid to perform their day-to-day lives even with this low vision. And there is another thing called as rehabilitation, where we train the kid or the adults to do their day-to-day life activities with help, even with this kind of low vision. That is called as visual rehabilitation. So with the help of low vision aids and visual rehabilitation, we can still help these kind of kids and adults who have this vision impairment. So all it needs is early identification and treatment in time. Thank you.